A personal health budget is funding that comes from the clinical commissioning group. It's money that's already in place, but it gives the client, the patient, the ability to be able to purchase their own care. So it gives them back a degree of control, and they can choose what care agency they use for their specialist care. No two long-term conditions will necessarily be the same, and even if they were, they may have different needs, and therefore we actually bespoke the training to whatever those needs are.
So Zach has got quite a rare neurological condition. His parents and family have been looking after him obviously since birth, and we were involved through our local continuing healthcare group that got in touch with us because they couldn't get training for the carers to make it very individual for Zach. And my colleague and I, Mike, went out to his house, met the family and some of the carers and obviously Zach. Looking at his sort of needs and training needs, we put together a programme for him for a one-day study day.
So we were asked to go and assess the situation to see whether we could provide bespoke sort of education and training for the care providers in order to support their needs and equip them and make them feel more confident, hopefully, in what they were already providing. Well, the day was an awful day in the sense that it was absolutely pouring with rain. We had an absolute barrage of equipment that we needed to get into the house, which we did. We were there to support the 6 main carers for Zach, along with his family as well. So it meant organising the living room, using sort of coffee tables as props for the projector, that type of thing. And having identified what it was they needed, we then presented a variety of presentations using PowerPoint, a lot of practical hands-on stuff. So it was great fun trying not to fall over somebody with a mannequin in the middle of the hallway. The cat was very interested as well, I have to say, but we didn't have to train him, so that was good. So it was about the fact of training in the realms of basic life support, nasopharyngeal suctioning, and tissue viability management, that is pressure ulcer management, medicines management, all the things that were identified at our initial assessment when we went to see Zach and his family as to the type of thing that they felt they needed updating and upskilling on. We don't actually partake in the paperwork or the application. We only become involved once the personal health budget has been approved and the client, the patient, is in possession of the personal health budget. And also it's really important to stress that we don't take over anybody's care. We are purely there from a support and an educational perspective, an educational and training perspective. We support the primary caregivers, so the healthcare professionals that have continuing responsibility for that individual. So we will support whoever takes that overall responsibility. But that doesn't mean to say that we won't signpost. With our experience, which is very varied and very wide, we may well find ourselves signposting somebody to another agency, for instance, if we identify that they need some help in that field.